Hello, my name is Dr. Barbara Rodwin, and I want to talk to you about the jaw. It's also known as the TMJ. T stands for temporal, M stands for mandibular, and J for joint. So that actually refers to T is actually temporal, being this part of your skull bone. M is the mandible, which is this portion of your jaw, and joint is the way it actually fits together within the space here. I'm a doctor of chiropractic, and I've been a doctor of chiropractic for over 26 years now, and I do treat a lot of jaw problems. A day doesn't go by where I'm not working on the jaw when I'm actually treating other parts of a patient. I've studied it both at chiropractic school and taken extra training for it. People don't often think of chiropractors as treating jaw problems, but I do get a number of referrals from different specialists to actually be able to help patients. So we're going to look at the jaw today, and what we'll look at initially is the anatomy of it. When you use your jaw and you open and close your mouth and talk, it's supposed to actually move straight up and down, like so. And when it does, it's actually gliding back and forth with this is known as a condyle. When I do check patients, some people, instead of going up and down, they actually go off in a C-shaped pattern or sometimes an S-shape, where it'll go down when they open and then back up in those two different positions. And that's indicative of the jaw going in a way out of alignment like this. And it can be due to the issues with that, due to the way that this condyle is moving in the groove. In between the condyle and the little groove on the skull, there is a disc. The disc can get scar tissue on it from the way it's being used and cause your jaw to shift. And that can actually cause issues with it. The other thing that allows for movement of the jaw are muscles. So it's the bone itself, the muscles, and the disc. So when I do check things, I evaluate all of that. We have to check the muscles that allow you to chew, and you use them on the outside part, and then there are other muscles that are inside that you use to open and close your mouth or clench. A number of people will get, so if you are having symptoms with your jaw, sometimes it could be a clicking noise when you open and close it, or you're talking, and that would actually mean that the jaw is out of alignment. So over time, if it is out of alignment, it can cause degeneration in the disc off to the side there and problems. So if you do have a clicking, that's an early warning signal that there's something wrong with your jaw and you should have it looked at. Other symptoms are it just feels sort of tight within the jaw region. Some people have it actually lock a little opened or closed. Some other people get headaches, and the headaches can be through the top of your head here, around to the top, or into the side, or even down into the neck or the front area, because the muscles that supply the jaw have different nerves that supply those areas in the skull region. So it is very important, if you're feeling any symptoms either in your neck, your head, or your jaw, to have that looked at and examined. Different reasons people have jaw problems. They chew gum, so I often say please don't chew gum because of that motion. The other thing that I do notice when I discuss things with patients is some people only when they're chewing food chew on one side or predominantly on one side, so you're constantly using just the one side of your mouth to do things. Some people grind, so there's a clenching. And then I do find a number of patients that have had braces or orthodontic work or extensive root canals and had to have cavities filled because of having their mouth open. It actually creates undue stress or pressure on it too. Or some other patients who have had their wisdom teeth taken out, they could have jaw problems. So you should have it examined and have it looked at. When you do have it examined, we will look at the motion of the jaw itself to check the movement feel if it's actually positioned properly, and check all of the muscles around there. And the jaw is actually factored into the skull region here too, so the skull has to be looked at as well with motion. So I do find with this technique that I practice, it's known as CATS, Cranial Adjusting Turner Style, it actually does help with alleviating some jaw problems when we work on this portion of the skull and the jaw. The other thing to think about with the jaw, when we do talk, so if you want to try it, you put your fingers back up through here and you talk, you can actually feel a vibration or motion of your neck. So when you do talk or chew or grind, you are using, because you can actually see that the skull is here and then the neck is just below it, you are using the top part of your neck with jaw motion. So what should be done as well when you are having your jaw looked at is the top part of your neck assessed too, to figure out if there are imbalances in there that need to be fixed. Because if all of it is actually fixed together, it aids in alleviating issues with it. So different types of techniques that can be used on it. One is known as the active release technique, and that's actually where we break up the adhesions within the tissues around the jaw. So think of an elastic band as being the normal muscles. And then if you tied some knots in there, that would be the tight spots or adhesions. We can use it on the jaw to help release the areas. Chiropractic with adjusting it, so I do know some different specialized techniques with being able to get it to move properly. I mentioned that CATS technique earlier on, the Cranial Adjusting Turner Style. Acupuncture can be effective on the jaw. Obviously, figuring out if you need a night splint. And as well, we do give home exercises such as icing. One good thing to do is when you're not talking is to rest your tongue on the roof of your mouth. And then depending on the issues that you have, we'll give you different exercises for the jaw or even the neck. So that's it for the jaw itself. If you have any questions, feel free to email me if you have a look at this and you're wondering what you should do for yourself for jaw problems. That's it for now.